My name is Marco Lagrada, and welcome to the latest edition of the Fightback Weekly Review. Now, in the last few days, there's been a series of reports released by the Canadian military which describe an absolutely horrific situation in the country's long-term care homes. They write about cockroach infestations. They write about unsanitary conditions. They write about residents screaming for hours before they receive help. And of course, to top it all off, they tell us again about the thousands who have now died in these long-term care homes, to such a point where now over 80% of the deaths in this country from COVID-19 can be traced back to these long-term care homes. So with these reports now being released, we have to ask ourselves, how do we get here? And who's to blame for this horrific situation? Well, some people have tried to point their fingers at the staff in these care homes. But the military report makes crystal clear that it's not them to blame. Staff who are overworked, underpaid, and homes which are by and large understaffed, making it difficult, if not impossible, to actually respond to the needs of their residents. So why then are these homes understaffed? Well, it comes down to a question of money. In the military report, 4 out of 5 of the homes listed in Ontario are for-profit homes. A poll was released the other day showing that if you live in a private care home, you are 4 times more likely to die than if you were to live in a municipal home. Therefore, it's the private homes, more than the publicly owned homes, which have become the epicenter of the outbreaks and are responsible for the overwhelming majority of deaths in these long-term care homes. And as I said, this comes down to a question of money. More specifically, a question of profits. Because increasing PPE, increasing hospital beds, increasing staff would affect the bottom line of these companies. Therefore, they don't do it. Now, sadly, while this has been going on, our governments have stood there like idiots, idly by, doing nothing. You have to ask, why was it the military that broke this story and not our government? Our government, which by the way likes to talk about all these inspectors that it employs that are supposedly monitoring these long-term care homes. Where are these inspectors then? Why didn't they notice what was taking place right underneath their noses? In fact, the government has done absolutely nothing to address these problems. And only now that they've been embarrassed by this report from the military are they finally beginning to take something resembling action. Just a few days ago, the Ford government announced that they'll be taking over 5 of these homes. And in BC, they've already taken similar measures. But we just have to clarify something here. They've taken over the management, yes, but they're not taking over the ownership of these private homes, which means that these owners will continue to profit during this crisis and presumably continue to call the shots since they continue to own these firms. Now, a poll was released the other day showing that 66% of people in Canada now favor nationalizing these homes, taking them into public ownership, and making long-term care a part of Canada's publicly funded healthcare system. But our idiot governments and our idiot politicians have totally ignored and dodged the demands from the Canadian public. And why? Because they don't want to upset their millionaire friends, these owners of these long-term care homes. So they haven't taken that measure, that absolutely necessary measure. The fact is that these private owners have long since forfeited their right to own and to run these homes. They've screwed up just one too many times, and it's had disastrous consequences for our elderly, for our loved ones. The fact is, we need to take these homes into public ownership in order to save lives, and that's borne out, by the way, by the statistics. But we can't stop there, because we have to ask ourselves, well, who's going to run these homes? Of course, the government says it should be them that has to run these homes. But do we really trust these government bureaucrats to do a good job? These same politicians who for years ignored and underfunded our long-term care homes? Who let this happen underneath their noses as these atrocities were taking place in these residences? I would say no. Well, who then's going to run it? And there's a simple answer to that question. It should be the workers themselves in these homes that make the decisions and run these homes. The workers who are in there day in, day out and know best how to get the job done. Listen, for years, while governments were ignoring these problems, while the private owners were ignoring these problems, it was the workers and their unions alone who pointed out these issues, who were calling for reforms. And at every step of the way, guess what happened? They were ignored. They were sidelined because the men in suits who own these firms and the politicians said, it's not your domain. It's not your decision to make. Well, it's reached a point now where these men in suits, these politicians, these owners have failed our population, have failed our elderly, and more than that, now have blood on their hands. They forfeited the right to own and run these homes. More than ever, to save lives and put an end to this horrific pandemic, we need to take these homes into public ownership, make it a part of Canada's healthcare system, and put these homes under the democratic control of the workers who know best how to run them.